We're excited to have a cardiac screening for young athletes. This is one thing that has kind of come out in the press over the past few years, and it's been around for a long time, but Providence Hospital cardiovascular department has really stepped up their role, and they're providing this cardiac screen. It's a $1,600 screen for $50. We're having it May 24th here at Spring Valley, and again this fall at Westwood.
Providence Hospitals has been in the Midlands providing heart care since 1974. We were the first heart program in our area. We have the highest rating available, which is a 3-star rating in cardiac surgery and cardiac procedures, and we are very excited to be able to extend that service, that quality of programs out into our community now and offer it to our athletes. We will be having a hypertrophic cardiomyopathy screening. It will be hosted at Spring Valley High School on Saturday, May 24th from 9 a.m. until 4 p.m. The screening is basically set up, it's an echocardiogram where they actually do an ultrasound of your heart. And what we're looking for is a congenital defect called hypertrophic cardiomyopathy. It's the leading cause of sudden cardiac death in athletes. Typically what happens is they come in for the screening. It takes about 10 minutes for the screening. Then the child goes back to school or goes back to their normal activities. We'll have a board-certified cardiologist will read the screen, will study, and then the parent will be contacted by mail and by phone if there's an abnormal result. So then at that point in time, the child will be brought back in for a full panel workup and then a cardiologist review from that.
I think this offers the district athletes, the district students, a way to come in and gives the parents of Richland School District 2 an opportunity to come in and provide some extra care for their athletes and provide an opportunity to come and get screened to see if is there any issue with my child, and really give that reassurance and that we're offering the district and we're providing our students and of this community and of our district an opportunity to get the best health care possible and to prevent, if we can prevent one cardiac episode with this, it's just a tremendous success. So our really goal is to reach out to our Richland 2 family and offer them a chance to see if their child has any of this cardiac issue, the hypertrophic cardiomyopathy, and to really see if that's diagnosed or not there at all.
The first symptom of hypertrophic cardiomyopathy is death. We usually don't have a lot of symptoms leading up to it. And you hear a lot about athletes simply because those deaths tend to happen in a very crowded, very public place. And so they get a lot of media attention. What you don't see are athletes or non-athletes who also suffer from this condition, who have problems at home. But the reason you hear so much about it is simply because of the public nature of the events. If they have hypertrophic cardiomyopathy, it's something they're born with. It tends to develop and be present at puberty. And people tend to have more difficulty with it from the ages of 13 to 25 or 30. And so usually when we do screenings, we do them from the ages of 13 to 26. Once a child hits puberty and they've had this screening done once, they will never have to do it again. So once you're screened, you either have it or you don't, and it's not something you ever have to have done again. This screening, the cost of this screening is $50 through Providence School of Cardiovascular Diagnostics. Because we offer that program at the hospital, we're able to do it at this cost. The typical cost for this screening in a physician practice or in a hospital setting is roughly $1,600. So we're very excited to be able to offer it to our community at that discounted rate. In order to register for the event, there's a phone number that you call. It's 877-256-5381. The people on the phone will get you registered to set for an appointment. We'll be taking appointments every 15 minutes from 9 a.m. until 4 p.m. and there's a $50 charge per screen.
Healthcare is our biggest priority to any level of athletes, from our middle school to high school athletics programs. Our goal is consistently to how can we best provide opportunities for our students and for our families of our county or for our district to get their children as the best care as possible. And from the athletic trainers in Richland too, we're constantly trying to figure out new ways to treat or better serve the athletes that we work with. There's the phone number that we have on the flyer, which is on the Richland 2 webpage, as well as the Spring Valley webpage. They will call this number. They will talk to a representative from the Providence Hospital Group, and they will register for a specific time for this event. And this event is offered at a reduced price. This screening would typically cost around $1,600, which we know I think most insurances don't cover, but we're offering this event for $50, which is just a tremendously reduced fee, and we feel as though it was too good of an opportunity that we couldn't let our Richland 2 family know about it, that we wanted to offer a couple chances for their students to come do this.